The question is that the grievances be noted, and I call the member for Greenway.
Thank you, Mr Deputy Speaker. I rise tonight to grieve for some particular cohorts in my electorate of Greenway who are doing it tough. I note that in an article earlier this year in the Herald Sun, it was noted that the 6th edition of the Australian Oxford Dictionary, which was released in 2017, included over 2,000 new words to reflect the evolution of the English language in our country. And it says, alongside millennial newcomers, was the term sandwich generation. Sandwich generation, a term used to describe the group of people caught between the responsibilities of caring for ageing parents and adult children. I think that more accurate there is not only adult children, but young children as well, because as I go about my community, I'm struck by the number of middle-aged Australians around my age, and I knock on their door and speak to them, or they approach me at mobile offices. And they're not asking for much. In fact, in many cases, they're not asking for anything other than to be heard. And these are people who are raising their own children, but through circumstances are also caring for elderly parents. In many cases, elderly parents or an elderly parent who has a degenerative disease such as dementia. And they are living in the same home as their children. So there's 3 generations living in the one home, which is, I think, a great thing to be around a large family. But it does include with it many challenges that have been made known to me by this particular cohort. It's a growing issue, and it's a story that I think many more Australians are familiar with, and more familiar with than we might think. Belonging to the sandwich generation can include providing financial support to one's parents or assuming the primary responsibility for healthcare. It includes taking time off work for doctor's appointments, covering out-of-pocket expenses and the costs of some medication, and for some it can mean leaving the workforce altogether to become a full-time carer. Now, as my constituents would know, having such a large population where 2 parents in the home are working, the logistics of life are hard enough as it is. So it's made this generational independency, which is becoming increasingly prevalent amongst families where an older member is living at home with a degenerative illness, as I mentioned, and unable to continue living independently, is a real challenge for many families. And just flicking through some of the media coverage, I see even in May this year, there's a suggestion that there's around 1.5 million Australians in the sandwich generation. And this reporting apparently relied on 2013 data, so it's highly likely that the figure is even higher today. And interestingly, a number of media articles note that the Australians fulfilling this role are actually mostly women. And whilst these women wouldn't change it for the world, giving voice to their struggle is really an issue. And I note on a particular article on 9Honey, this individual said that in my case it wasn't financial in terms of caring for young children and elderly parents. It wasn't financial, certainly emotional and physical. I was 36 when I had my son. He's now 13. My mother was 36 when she had me, which meant by the time I had an infant, my parents were 72. So these challenges, I think, more than anything, we need to listen to people who are in this situation. And given their dual responsibilities, we need to understand what the consequences will be in the immediate and long term. It means that around 1 in 3 people from the sandwich generation will retire with substantial debt, and that's according to a Rest Industry Super report from 2017. And with an ageing population and with waiting times under this hopeless government when it comes to aged care, home care packages, with that increasing, it's only going to get worse. I'm frequently contacted by local residents who are desperate to continue living independently, but too often, by the time spent waiting between lodging an application and its assessment or its approval and delivery, they are in many cases forced to rely on the support of their children who are in this sandwich generation. And when you have the cost of everything, everything going up except wages. It's no wonder the cost of living continues to rate as the top issue for so many Australians. And, you know, as parents and children ourselves, it's people my age who understand these dual pressures. When tasked with the decision to either support your elderly parents and children, I don't think many people would even bat an eyelid. They'd support both. But it doesn't mean that we need to accept that they'll be financially worse off as a result of making that decision. My colleague, the member for Fenner, very eloquently summarised today that after 6 years of this government, the economy's floundering, Australians are struggling, this government has no plans to turn things around. Economic growth, the lowest, slowest since the GFC. Wages are stagnant, almost 2 million Australians looking for work or more work. Living standards and productivity are going backwards. We've got collapsing confidence and weak growth as the inevitable consequences of a government with a political strategy but no economic policy. And it's a situation like that that is not going to provide the solutions that the sandwich generation needs. I think it's very important that we recognise the plight of Australia's young people, the plight of people who are in this situation, and address, for example, the issue of unaffordable housing in this country. We need to have a real wages policy to get wages moving again and to help young people to live independently. And also we need to address the astronomical waiting times for home care packages to help older Australians to continue to live independently. We should also seriously address pension deeming rates to increase the amount of money in the pockets of older Australians. I think it's a shame when we have a situation, given that our older generation who have done so much and middle-aged people like myself who are still in the workforce, raising families and are doing it tough and are not given a voice in this parliament. As I said, when I speak to and listen to these people on a regular basis, they are not asking for much, More often than not, what they are asking for is some recognition. So with those comments, I want to end by talking about, again, what is a very serious issue affecting families in my electorates, and that's the state of healthcare. It was reported only last week that the New South Wales Liberal government issued a directive to the head of the Department of Surgery at Blacktown and Mount Druitt hospitals to cut the total number of elective surgery sessions carried out in 2020 by 400. And in an email circulated to his staff, the head of surgery said, and I quote, "I have no doubt that if such changes are introduced, many patients will experience significant breaches in waiting times. Despite this, a decision has been made to reduce activity." Now, it's well covered in the media that elective surgery waiting times in New South Wales are only getting longer. Now, these surgeries are not luxuries. It's disappointing, to say the very least, that the New South Wales Liberals think that they are ripe for cutting as part of their cost-saving agenda. Procedures in areas such as general surgery and orthopaedics will be affected, including hip and knee replacements, procedures affecting the stomach, breast, liver, gallbladder and appendix. In the same email, the head of surgery also said, "We do not support any reduction in elective surgical services at all. What was explained to us was that if we did not sort out how to do this as a department, it would be done for us by hospital administration." This is a callous and cruel directive. It's absolutely astounding. Here we have compassionate Western Sydney doctors and healthcare professionals who do not support this decision and have gone public saying so, because of the adverse impacts on patient outcomes being forced into cutting procedures in the interests of saving money. And if they don't cooperate, because it will harm their patients. Now, in terms of its population, the Blacktown local government area is one of the largest in all of Australia, and it's still growing. And despite these trends, the Liberals' approach to healthcare is to cut local services. Well, the mind absolutely boggles. And when questioned by the New South Wales opposition, the New South Wales Minister for Health laughed and joked with his colleagues. Now, this is not a laughing matter, nor do I or my colleagues in this place or the residents whom I represent who will be impacted by this decision think that this is a laughing matter and the Minister should be absolutely ashamed. And even more frustrating is the fact that the Liberals continue to overpromise and underdeliver when it comes to healthcare. In the lead up to the 2015 election, the New South Wales Liberals promised a new hospital in Rouse Hill. we still do not have that delivered. Not only did they not deliver it, they've announced a site and a so-called hospital, a hospital with no beds and no emergency ward. Western Sydney deserves better.
I thank the